As your child becomes active in sports, concussions can become a major concern. Hospitals are seeing more kids come through their ERs with them, and many parents don't know the signs and symptoms until it's too late. Dr. Jennifer Yuen is a pediatric neurologist at Cardin Children's Medical, and she's here. She's going to help us out today. Thanks so much for talking with us. This is so important because you're seeing it more and more, right?
Yes, thanks, Destry, for having us on. Yes, we are seeing concussions more and more.
Yeah. Why do you think that is?
I think that it's happening more just because I think we're seeing them more because more people know about concussions and therefore see their physicians because.
Yeah, and it seems like kids are starting sports earlier and everything else. But let's start with what exactly is a concussion?
So concussion really is a syndrome of things. One of them is that there's some sort of a force to the head, whether it's a direct hit to the head, a neck, or the body that would cause an impulsive force through the head. And then it comes with a bunch of symptoms. And usually a concussion does not involve actual injury to the brain. So if you have skull fractures or bleeding, then it becomes a traumatic brain injury. Then it's something completely different.
Well, what are some of the symptoms of a concussion in particular?
Okay, so it comes into 4 different groups. One is the physical symptoms, meaning headache, nausea, vomiting, and dizziness, very common. And then another one is emotional. Kids are a little bit more irritable, fussy. And then another section is sleep. They become more sleepy or can't sleep at all. And the other one is cognitive, which is a very important one that gets missed very often, is that they have ADHD type symptoms, can't concentrate, their schoolwork takes them longer to do.
All right, so that's all symptoms to watch out for. If you find out they do have a concussion or had a concussion, how long before they should go play a sport again or go to practice again?
Very good question. And most people say 2 weeks. I say 2 weeks because concussions, if treated appropriately, should resolve themselves within 2 weeks. But by treating them appropriately means that you have to have both physical rest and brain rest. And brain rest, so as if you were to break your leg, you propped it up. You don't use it. Because if you keep using your broken leg, it's going to stay broken. Same thing with your brain. It's a lot harder, though, to rest your brain because you use it to think, to read.
So you say sleep and...
Not necessarily sleep. It's not really bed rest so much as I'm okay with them, you know, taking a stroll around the house and all that stuff, but just no television, no video games, not even reading. Reading can affect your brain.
Interesting.
Because that makes your brain work.
Okay, and that's really important to make sure you're treating it the correct way so you can get better.
Correct, and there's actually a pathway into getting back to both school and physical like physical sports. If they were a sports player and got injured there, it should take no less than 5 days to get back to playing. So if they got hurt on Friday and they got a big game on Monday, it's a no across the board. Correct. They have to be symptom-free.
Well, and the main thing is you don't want any long-term effects.
Correct.
What are some of the long-term effects that can happen?
Some of the long-term effects, especially if it's not treated appropriately, we see are cognitive side effects, trouble with school, slower processing speeds, and just longer time to do their homework. Not necessarily physical, although we can see some kids with still mood problems after a concussion if not treated appropriately.
What about treatment options for kids that have suffered that concussion? What are some of those options?
So the options, first and foremost, brain rest. That's going to be the #1. If the symptoms such as headache or dizziness persist, even if they've done all the brain rest protocols, we are medicines for headaches. There's also something that I love, vestibular therapy, for kids with dizziness. Dizziness is oftentimes a hard thing to treat, and I've only heard great things about vestibular therapy for kids with dizziness.
Very good. A lot of treatment options, but you have to know the symptoms and follow up on that. For more information, everyone, you can go to totalkid.azcentral.com. And check out the Total Kid app, now available for iPads. The Total Kid app can be your source for health information from the experts at Banner Children's. Featured topics include robots to the rescue, living with migraines, and when kids should stay home from school. It has a lot of great information on it. Any parent is going to love it and use it. Total Kid also features kid-friendly recipes and safety tips. To learn more, all you have to do is go online, go to totalkid.azcentral.com.